to start all over. I don't have the mic on. Oh, it's here. Okay. I'll just bear with me. Okay, let's try this again. We've had a lot of practice at this. We should have been able to get our mics set and all that kind of stuff. That's my fault. But today is June the 10th, Wednesday, and this is our briefing today. Unfortunately, we took yesterday off, but we also lost our 85th person. A 65-year-old male from Kanawha County, and like I've said over and over and over, same thing. Please don't ever let these people become a statistic. You know, I hope and pray in every way that at some point in time we can string together lots and lots and lots of days that we don't have a death. And even though the total number is very, very, very low, this total number is still 85 wonderful West Virginians. Please keep this man in your thoughts and prayers, and all of his family and all of his loved ones. And let's don't let them in any way become a statistic or believe that they're going to become a statistic. That we just need to let that family and everyone know we lost a man that 65 years old, a young man, and we just need to let the family know they're not alone, that we're all in this together, and we're surely praying for him and praying for this wonderful man and all that he gave each and every one of us in West Virginia. Now I want to read just a couple things. This is the 7th week of the West Virginia Strong, the comeback, the reopening plan. Today, our private and state park campgrounds are now allowed to accept out-of-state guests. All of our guidances are up on our website. I promised you today that I would give you guidances on visitation at nursing homes. Because these people are, we know, they're the most vulnerable of all, and so therefore we're going to phase in this visitation. We're doing it as quickly as we possibly can, but on Wednesday, June the 17th, if a nursing home has had no active COVID-19 cases for at least the past 14 days, going back to June the 3rd, limited visitation can begin immediately. And all these facilities must certify to the DHA through the DHHR before they can begin visitation. Guidelines will be up. Secretary Crouch and Dr. Slimp will tell you more about these guidelines as we go forward here today. The bottom line is just this. We're going to do this by appointment only, and so as our nursing homes open back up to visitation, you're going to be expected to call and get an appointment at a time when the nursing home can accommodate you to come and see your loved one that desperately needs you to be able to see them. In trying to protect these people, we had to do what we did. But at the same time, if you just step back and think about it, if it were your mom or your dad or your grandchildren that you just want to see, in all those circumstances, this is horrendously difficult and horrendously sad for those families. So we want to get you back together. We want to get you together as safely as we possibly can and protect all those within the nursing home system and everything. All the nursing home people, I've had a lot of discussions with them. They're absolutely going to do great work in trying to assure that we protect everybody, all the people at those facilities. And so they're on it. They've got some great plans and great guidelines and everything. But 7 days from today, we're going to begin visitation at our nursing home. So I think, that's to me is the advice of the nursing homes on what they're going to be able to do, advice on our expert community from the health side, and as well as the CDC guidelines and everything. All of it comes together, and we're going to be able to go back to seeing your loved ones and everything, and there'll be happy days, starting June the 17th. So. As far as summer camps, as I announced on Monday, summer youth camps may resume next Monday, June the 22nd, and the guidelines for those are up. As far as schools and graduations, today the West Virginia State School Board released their school re-entry scenarios plan, which we worked closely with, and I totally support. Today, the school board and the Superintendent Birch will release guidelines for counties to use to begin holding graduation ceremonies. This is something that I wanted to see in the worst way. Now, there's been a lot of graduations that have already happened, where we've driven through and done different things, and I salute everybody for that, and I appreciate all the hard work, especially that Superintendent Birch and all of his team have done to work on this, because this is such a important and very important moment for these children, along with all of their families, because this is an accomplishment beyond belief for these kids and everything, and we sure want them to have some level of some type of graduation. So we're, naturally, as far as our guidelines, they're going to be released. As far as all the safety protocols and everything, you'll see all that as well. As far as outdoor concerts, on Monday I announced that outdoor open-air concerts at fairs and festivals will be allowed to resume on July the 1st. And today we are also adding that all outdoor concerts at open-air venues may resume with the same guidelines that fairs and festivals must follow as well. I announced to you that the whitewater people, the rafting people, were really concerned because we'd gotten a lot of rain. The rivers were up and everything, and we were limiting the number of people that could go in a raft and everything. And I just felt like that we need to listen. We need to listen to that community and everything, because we were really putting, people maybe in harm's way, that we didn't have enough, people in the raft, maybe waiting the raft and everything. And so we listened to those people, and those guidelines will be posted, on my website now, but I want to thank all the rafting industry for giving us a lot of input on that, and stepping up and committing to the safety and of the operation and safety of all the guests that they have. So that's good stuff. I want to shoot a little shot across our bow in regard to our churches. Since churches have resumed in-person services, we have had at least 4 church-related outbreaks across the state, with 5 to 8 or whatever cases in a congregation. In total, we have seen 24 positive cases from among church members. We all know that a lot of the attendants at our churches are our elderly, and being the most vulnerable of all, we surely don't want to get in a situation to where we're passing COVID-19 on to our elderly. And so all I am doing now is just encouraging you, in our church settings to be to just follow the guidelines as far as every other pew, as far as your social distancing, as far as wearing masks. Listen to Dr. Marsh as he says, singing or talking loudly and everything spews this terrible disease and everything. And so be cautious, just be cautious. That's all I'm saying. We love our church activities. We absolutely treasure them the most of all. And there is the number one thing in our lives it should be, in my opinion, always. But I'm just cautioning you to just take heed and just be a little careful. As far as our cities and counties applying for those dollars that are going to be zinging out today, and millions of dollars of funding will be released this week, like I told you before. We now have 44 applications. That's good. It's going up. That's all good. And I think what's going to happen here is we're going to get a lot of money out to our counties and our cities and everything, and that's going to stimulate our economy and prop up our counties and our cities and make them in good shape. So all that's happening, and it's happening right now. I encourage more and more and more to apply, and we'll get them out just as quickly as we possibly can. Let me tell you a really good story here. We got a really good story to report on our jails. I want to give you an update on our enhanced testing initiative at our correctional facilities. We're still on track to complete all that testing by June the 12th. As of this morning, there are only 5 remaining active COVID-19 cases at Huttonsville. 116 have recovered. That couldn't tickle me anymore. When you just think about it, we've had 121 cases, if I'm doing the math correctly, and we've got 116 of those 121 that have recovered, and let's hope and pray we get through that. Don't have a death, don't have anybody in super critical condition and everything. Wouldn't that be a great story to tell? There are a total of 10 active COVID-19 cases at 4 jails and 2 prisons. Beyond that, the enhanced testing results are posted on the website, and like I said, by testing everyone all around everywhere, we have put the stranglehold on this terrible disease, and we've stopped it in its tracks in lots and lots of places. So great work by our corrections people and lots of people out there. Couldn't be more proud of you. We've got our free testing of our minorities. Especially we want to zero in on our African American communities and everything to where we get as many African Americans tested as we can, because we all know the situation to where the African American deaths and positive were skewed on a national level beyond what they should have been. And so we know we have an issue there. Come out and be tested. We'll be on this Friday and Saturday, June the 12th and 13th. We'll be in Greenbrier, Hancock, Logan, and Wood counties. We'll also be testing on June the 13th on Saturday only in Grant, Hampshire, and Hardy counties. And so come out. Won't cost you a nickel, and absolutely it's painless, and we'll get a test, and it may very well end up saving your life or one of your loved ones. So come out and get tested, please. 2 more things real quick. Our summer feeding map project announcement is up. Now we got 670 sites. If you have any concern about where you can go and pick up food, because we absolutely want to take care of our elderly, we want to take care of our kids, we absolutely have to take care of the hungry. In this state, we're going to do that, and we're going to put a stake in the sand that we're taking care of our hungry, and we're helping our neighbors and doing the great work we should be doing. And so, but if you have a question about that, call 211, and somebody will pick up and be able to assist you. Last thing I've got on my list is remember the census. You got to remember the census, everybody. We got to be counted. And my last of my last is to go through these graphs. I always have been doing that with you. Some days I guess I get going and I kind of forget to do that. But, if you look at Jordan, I'm kind of waiting on you. But if you look at the top graph, you'll see that our recovered cases and active cases, still are trending exactly the way we want them to trend. The wider they get, the better. If you look back to May 1st, and you'll see that we were almost clamped right together, and so we want those lines to just widen and widen as we go. The next line down is our positives of today, and it shows that spike. That one spike there, is Huttonsville. But if you'll go on out and you'll look every day, it's 1.23. Today, or yesterday rather, it was 0.58. It was right at 0.5%. It's an amazing number. Good stuff. And now our cumulative positive cases in the state of West Virginia have drifted to the lowest cumulative number that we have had to date. It's 1.86%. Can't be any better. Absolutely, West Virginia, you're doing it. You've done it all along. You've been the miracle that I've said over and over and over that you are. I could never be any more proud of just what you've done, West Virginia, and just keep it up. Keep up the great work. Really proud of you. Thank you so much.
All right, thank you, Governor. Let's first today go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good afternoon, everyone. As the governor announced, nursing homes will begin a phased approach to opening back up. We want to make sure as this phase goes through the next several weeks that everyone is kept as safe as possible. Facilities will decide at the pace they want to pursue this. Obviously, they need to be COVID-free, as the governor said, for 14 days. Minimum of 14 days. There's also non-essential personnel that will need to begin visiting the building again. Each facility, that's podiatrists, also nutritionists, beauticians. You'll have many patients there who may want to see the beautician before they see their family, actually. So this will be a process where increased group activities begin in the facility. And things get back to more normal as we can right now. Families will need to schedule appointments. We'll need to contact facilities and schedule coming into the facility. If those visits can be outdoors, that is even better. The number of individuals, the number of family members being able to come in will necessarily need to be limited because of space within the facility. So you'll need to contact facilities. All of this is done again to mitigate risk. We want to reduce the risk to our elderly population. We want to make sure that individuals use face coverings, masks in the facility. We want to make sure that you self-distance. I know folks are going to be anxious to hug their loved ones, their mother or father, or their grandmother and grandfather. Try to resist from that at this point as best you can. Keep your visits as short as possible so that the risk is mitigated even further. Again, distance, face covering for the droplets. Hand sanitizer is critical. The facilities should have hand sanitizer available or hand sanitizer stations available. So again, as the governor said, be cautious, go slow. And again, the facilities will be the ones who will determine whether or not they can open and how quickly they can open based upon a variety of issues in that facility, including staffing, et cetera. So we'll be all looking to them in terms of the timeline for each of those facilities. And again, the bottom line is be safe and be cautious. Thank you.
All right, thank you both. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. I want to touch on a couple of things today. Number one is what the governor shared with everyone about the issues that we still need to be very diligent in our approach to protect ourselves and each other from COVID-19. We have seen some outbreaks in churches, and we know that 19 states since the Memorial Day holiday have seen an uptick in the number of COVID positive people, and 9 states have seen an increase in the number of people that are being hospitalized. And one state, Arizona, has activated their emergency plan because they are seeing more people in the ICUs than they've seen before. So we still need to recognize that COVID is out there. And I will just reinforce the 3 C's from Japan, that we should avoid crowds. We should avoid constant contacts of people that we don't live with all the time, not our family. And we should also avoid crowded indoor spaces. And if you need to be in crowds or around other people, or indoors where you're shopping or doing other forms of business, then wearing a mask is so important. Remember, we talked about mask wearing cultures and comparing Hong Kong to Sweden. Hong Kong and Sweden both stayed open the whole time the COVID pandemic has been upon us. Their schools open, their subways open. Still in Hong Kong, there's only been 4 deaths that have been affiliated with COVID infection. And in Sweden, that doesn't wear masks, they're almost up to 5,000 deaths. So ultimately, we know that masks do make a difference. And if all of us wear a mask, we protect others from being infected by us, not necessarily only to protect ourselves. The World Health Organization came out earlier in the week and said that asymptomatic people don't spread COVID virus, and that's been walked back quite a bit. As we talked about, there are people that are super spreaders who are associated with much more virus spread than others. In the pre-symptomatic time, the time before people get symptoms, these people tend to be very infectious, and right at the beginning of symptoms, really infectious. So we can't really determine who's asymptomatic and who's pre-symptomatic at the time before symptoms start. So that's the reason why it's so important to protect ourselves with masks, with physical distancing, and with good hand hygiene. Now, our RT value, our reproduction score, is going down, which is great. Per the RT website, we're at 0.89, which really is including a lot of past cases. When we look at our internal RT values, we're a lot better than that. We're about 0.6. So ultimately, we are doing well. West Virginia, thank you for what you're doing, but you need to keep it up, because anytime we let our guard down, this virus will come back and make us pay for that. So well done, but plenty more to go. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Highlight a couple of items today. Starting tomorrow, the National Guard will begin to resume normal training activities, starting with the airlift wing out of the Eastern Panhandle. As a part of that, we will be working on the appropriate mitigation techniques to protect our soldiers and airmen, as well as we will be doing a comprehensive testing initiative for our Guard personnel to further help with the health of the force, but also to look at the biopsy initiatives, as all of our Guard members come from all 55 of our counties across the state and our surrounding areas. We also are doing a lot of preparation, as the governor pointed out, significant number of test planes this weekend. So a lot of logistics and preparation for that. Also want to highlight some initiatives that went on in partnership with the West Virginia Office of Technology and the IT staff at DHHR. We've done some cyber hygiene initiatives on systems that are important to us to make sure we maintain the integrity of those systems going forward, and all that went exceptionally well, and certain changes are in place to better improve our cyber posture. As we know, there are a number of actors out there attempting to use this pandemic to address threats to us related to cyber. And the last thing is an effort is going on logistically to distribute cloth masks to all K through 12 institutions, as well as higher education institutions, in preparation for the fall school year. Thank you.
Thank you, General. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I've been hearing some chatter from fire and rescue squads that they are having an extremely tough time making it through this time. They can't hold their fundraisers, and personnel has been a problem for a while for them. Is there anything in the CARES Act that could help them out and get them over the hump as we get through the early parts of this recovery?
I think that's a great question. It's not, that's not come to me yet, and I think it was Paul, but that's not come to me yet. But let us do a little research and see what we can figure out, and and see if there's a way that we can, if something, that we can fit them into the process here where we can try to help. But that's not come to me yet. But I'll get you an answer.
All right, thank you, Paul. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Oh, hi, Governor. Hi, Governor. While we do this press conference today, the state school board is also talking about the re-entry for school in the fall. Have you been updated on those plans, and do you have a feel for how they may proceed?
Brad, I have been updated. I've not been completely and thoroughly updated. I mean, they're working through this. I think they're on task and everything. They're the bottom line is school probably is going to be a little different, but there's going to be combinations of our virtual learning and crowd size and keeping certain classes together and everything. There's lots and lots and lots that we could talk about this, but you'll see the outcome of all this very soon.
All right, thanks, Brad. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, I've talked with some restaurant owners who wanted me to ask you, now that we've got indoor dining, and of course the outdoor dining went in first, and now that outdoor concerts have been approved through July 1st, what about the situation where these venues who are restaurants and in some cases bars, where they have live music and live entertainment? Has any thought been given to lifting the restrictions on those types of things for those businesses? What I'm hearing is a lot of the musicians during this time obviously have been idle. Some of them have not qualified for Workforce West Virginia benefits, so they're struggling greatly. And if they were allowed to go back to these venues, these restaurants which have entertainment and bars, it would help them and their families pay their bills. So where are we on allowing restaurants to begin that aspect of their normal operations?
Kenny, all of our outdoor rules will be going up today. From the standpoint of them, having a little patio or something like that, and them, having the music and the entertainers there and everything, that'd be great. But as far as all those outdoor rules will be going up today. And the other thing that I want to do is continue to try to address the situation to where, as far as capacities and things like that we're working on. And we're continuing to work on that. We'll do some more work on that, even the schedule for later today. But, I am well aware of how difficult it is to run a business, with one hand tied behind your back and everything, as far as being able to be successful and making the economics work. And so we got a lot of great people that are really trying hard. So we're trying to help them in every way we can.
All right, thanks, Kenny. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, you had a very successful election last night. To what extent do you think these daily briefings and viewership has had some impact on the election outcome and has benefited your candidacy?
Well, Phil, to tell it like it is, first of all, last night there was a loud voice that spoke. We all know that. From the standpoint of these briefings, to just tell it like it is, if I would have got in here and pushed the wrong buttons, this would have been the place that it could have been politically suicidal. I've been here every day. I've answered every single question. I've given our great people of this state to see my heart, my soul, my thought process, how I went about all the decision making, how I handled the economic situation and all the terrible parts of this thing from the standpoint of the dreaded pandemic and trying to protect us. But the long and the short of the whole thing is just this. I'm honored to have been here and to have led you through this thus far. And I've told you over and over that the road could still be bumpy. And we are the most vulnerable of all states. And absolutely, without any question, I have been here with the thought in mind of zero politics. I want everybody in this state to understand just one thing. Think about this for a second. Over and over, day after day, day in, day out, I have had to come to you and announce that we've lost great West Virginians. I don't think anybody in the world ever came and said, we lost a good Republican or we lost a good Democrat. We lost a good independent. When it really boils right down to it, we should be West Virginians. We should be all pulling the rope together. This politics stuff, to be perfectly honest, has never appealed to me. Never. I have told you over and over and over, we should always lay that aside and do what's best for West Virginia. So I hope to goodness, that the people have seen my soul, seen my heart. This is not politics. We have dealt with life and death. We've tried to protect you as best we can. Now we're trying to get the economics part straight while still protecting you. Absolutely, this exceeds anything whatsoever to do with politics, and thank God it did, because at the end of the day, if we were in here playing games with politics, we were playing games with people's lives, and that would have made me sick.
All right, thanks, Phil. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I know, Governor, you just touched on the fact that you don't know the specifics are still being worked out when it comes to school guidelines. It's obviously unconventional. I know health is obviously the top priority, but education is too. If kids are going to school in fragmented days or for longer periods of time or shorter, do you worry about their educational growth?
Amanda, sure do. That's the thing. I'm asked all the time, are you concerned about this level of reopening? Are you concerned about, this level of closing visitation to our nursing homes? Are you concerned? Well, sure. I'm concerned about the kids' learning process and how disrupted this whole thing has been. And we are working hand in hand with our great Department of Ed and all the great people, hand in hand, to be able to try in every way we possibly can to ensure that learning process will continue and absolutely be interrupted only to the smallest degree. But concerned, you're dadgum right. That's all there is to it. Our kids are so precious, it's unbelievable. And this level of disruption can really, really, really hurt. Sure, I'm concerned. We're doing the very best that we can possibly do, listening to the experts and making our way through the wickets. But at the end of the day, we're going to continue to have to adjust and adjust and adjust, because this pandemic was the cannonball of all cannonballs to all of our stomachs. And we really and truly are just dealing with it the very best we possibly can.
All right, thank you, Amanda. Next, we'll go to Kara Lofton with West Virginia Public Broadcasting.
Hi, folks. Kara Lofton with West Virginia Public Broadcasting. With all of the protests that have been happening recently around Black Lives Matter, one of the things that I think would be of concern from a public health standpoint is a coronavirus outbreak. Should people who've been attending protests, especially people of color, get tested if they have been going to protest and engaging in these types of activities?
I sure would. I mean, that's all there is to it. You know, the test is painless. The test is free. You know, I absolutely would encourage all that have been, you know, at these gatherings and you know, to be tested and everything, because you've got a lot of people that are, you know, not wearing masks, a lot of people that are talking, and a lot of people that are very, very close together. And while you have opportunities to lay aside maybe some anxiety levels or whatever it may be, go get tested. Absolutely. I think that's a very good point, and without question, I'd be tested.
Thanks, Kara. Next, we'll go to Charles Young with WV News.
Hi, Charles Young, WV News. Governor, you know, we've had a long list of things reopening. We're on week 7 of the plan, but I still haven't heard anything about office workers, state workers getting back into their buildings. Surely if we can go to fairs and festivals and out to the movies, I think it'd be safe to send workers back. Do you know when we're going to get that announcement?
Charles, our people, you know, are bringing out those guidelines and everything. You know, I've approved the plan of how everything was to come out, and our agencies, you know, have those plans or have the plans in their hands now, and you know, so Charles, I concur with your feelings about people coming back to work and everything. We want to encourage, you know, people to have the opportunity to work at home and get the work done there. And if we can get that done, that's great. You know, there's all kinds of you know, situations and everything. But we're working on it, and we're working on it with our guidelines and our agencies. And I think we're moving in the right direction there.
Thank you, Charles. Next, we'll go to David Beard with the Dominion Post.
Hi, this is David Beard. I received a question from a reader. She had postponed her wedding for the pandemic, and now that things are opening back up and some of the gathering numbers are being revised, she wants to know how that affects a private gathering like a wedding, and how she can figure out how many people to invite. Thanks.
Okay, David, I really need to ask one question of my general counsel. I think that those are essential now, and you know, well, so I don't need to ask the question, you know, but I think they're essential now, and so these guidelines and rules don't really apply to them. Is that not correct? And so have her please call in to us, and but I think she'll be able to enjoy a beautiful wedding. I congratulate her in every way, and if she'll call into us or go up on our websites and look really hard, I think the weddings are essential, and from that standpoint, these guidelines don't apply.
All right, thank you, David. Next, we'll go to Mark Curtis with Nexstar Media.
Governor and staff members, good afternoon. Good to see all of you today. Governor, you talked about whitewater rafting. We know the present limit is 6 people per raft. We know the industry wants more people per craft allowed per raft. Can you tell us what that number is that you've settled on? You don't need to get into all the other regulations. I realize you're going to post them later, but I think people want to at least know how many people they can put in a raft and plan accordingly.
Well, I think the number's 8. That is, unless they're of my size. And if they're my size, we can't get 8 in the raft. But I think the number's 8. And we're still going with the thought in mind of trying to keep them from the same family or the same group that's traveled together to come there. You know, so that's basically the guideline. The guideline was go from 6 to 8 and stay within a family or a group that came there. You know, in other words, if we got 6 people in a group, we can't pluck somebody from, you know, Los Angeles or whatever it may be and put them in the group and everything. That's how we tried to do it.
All right, thank you, Mark. Next, Taylor Stuck, Herald Dispatch.
Hi all, it's Taylor with the Herald Dispatch. I think this question is, I'd like to get Dr. Marsh's opinion and maybe some other of the health officials of how do you marry the two ideas? I feel like, people are looking to the state for guidance and they can go out and do all of these things, but at the same time, the state is saying, don't be in crowds but you can still go to the mall. So like, how do you kind of marry those two different messages coming to the public?
Dr. Marsh, it's you. It's you. I like that coat you got on too. You look awfully official right there.
Thank you. Yes. Well, Taylor, that's a really important question, and we've tried to address that in the following way. So we very much want people to be able to go back out again. For instance, there's people that have put off having medical procedures, and we feel like that it is safe to go back out, to go get the medical procedure you need, to go to the store, go to the mall, go, where you need to go. We also, though, recognize that the COVID virus is still with us. And so how do you marry let's get people back out safely, but let's also make sure that people are protected, people are safe. And that's really what we've tried to emphasize around the use of masks and face covers, physical distancing, and hand hygiene. And ultimately, there's times you can't separate by 6 feet, and it's just not possible if you go back out. We know that being outside is safer in many ways than being inside. So if you're going out in crowds, then being outside is good. If you're going to be close to people who you don't live with all the time, your family, then wear a mask or a face covering. We know if 80% of people wear masks or face coverings, then that is really very much protection. It'll make that R value, the reproduction value, fall down. So we believe if people do this, and it's been shown in many studies, it's been shown in countries that we've just talked about today. There's a new study from the United Kingdom that says, again, if we wear face masks at a high prevalence, 80% or so, then we should be able to come back out safely and not get the COVID virus. So ultimately, we want people to be out, but be safe. And remember, being safe if you're with other people and inside is wearing a face mask or a face covering. Try to stay distanced from people you don't live with as much as possible, and make sure your hands are clean and you avoid touching your mouth, your nose, or your eyes. Thank you.
All right, Governor, I'll turn it back to you.
Okay. Let me end by just doing this. First of all, I can't stress enough the fact that just how good West Virginia you've done. But at the same time, I keep over and over saying that this virus is still right here with us, and this killer is right still in our midst. And we lost a 65-year-old male that we just lost. Don't be the next statistic. You have done phenomenal. I urge you to try as best you possibly can to wear your mask if you go outside, and to protect the elderly, and to do all the things from social distancing to just being careful. Just look after yourself. If you protect yourself, you're protecting others. That's all you have to do. Just protect yourself. Now, I've said that till I'm blue-green. Dr. Marsh, the same thing. All of our experts, the same thing. We all recognize just how great you've done. Our National Guard is so unbelievable, it's just off the chart. I love them with all my soul, as the same with our local health departments and all the first-line people from our healthcare community to first responders to on and on. They've all done great. You've done great. And the numbers show it. Now, if we could just end with just this, put the graphs right back up there just 1 second. I want to tell you something that is, you see, I'm a math guy. I'm always looking at the numbers. And while Dr. Marsh was talking, I was just looking down here at these numbers. But look at the cumulative, the line in the center. Go back to May, the 1st of May. Those spikes, look at Huttonsville. Huttonsville, we had an all-out outbreak. But look at the level of the spike compared to Huttonsville, way over on the right-hand side. These spikes were shooting sky high, much higher than Huttonsville. And this was from May the 1st through about May the 17th. Some time period right through there. If you'll look at the line below that, through that same time period, our cumulative positive cases were trending from about 4.5 up to 5 through that kind of level, all right through there. The same time period up till about June or May the 20th or May the 17th, something like that. Now just stay with me and come back to me, Jordan, just 1 second. Stay with me really, really close and just think, because the sun's shining and we absolutely think, we got this thing licked. This thing's behind us. We got it licked. We can really just turn it on and everything. Now, if you had paid really attention to those graphs, you would have heard me say, up through a period of about May the 1st to May the 20th, we had spikes that were going as high as 11.9, 12%. We wanted to be under 3. Think about this. Our positive cases on a cumulative basis were running from about 4.5 to 5. On Friday, it's all going together now. On Monday, New Jersey, which has so many people that have died like flies, it's unbelievable. They've just dropped everywhere. New Jersey was at like 3.69 cumulative. In this period right here, we were constantly 4.5 to 5. New Jersey on Monday was 3.69. So what I'm saying to you is this, with all kinds of people still dying, New Jersey on Monday, we were at 4.5 to 5% for 20 days through there. Then all of a sudden, we really, really started to move in a really constructive, positive way, and we started to reopen. Now, think about that. 20 days. How long has it been from right today back to where that time ended? 20 days. 20 days. Now, if you think that it's over and absolutely you can do any and everything you want to do, you're making a mistake. You're making a mistake. It's just been 20 days since we had a situation that it was significantly worse than where New Jersey is Monday. 20 days. So please, all I'm doing is just doing this. I am being your governor that is trying to look out for you, and your governor that congratulates you on all the unbelievable stuff that you've done. The governor that is trying to get us reopened and our economy back going and people with jobs and opportunities and the economics all working. The absolutely guy that is sitting right here is telling you this wake that we were in was only 20 days ago. Just continue to try to be careful and absolutely take the advice of that great, great medical community that's right there telling you what to do. Whether it be Dr. Slimp, Dr. Marsh, Secretary Crouch, General Hoyer, and all those people, they have been superstars. But all the network around them, all the county health officials, all the first responders, everybody around them has just absolutely been on their game. We've only been 20 days from bad stuff. Let's string this into lots and lots of 20 days. You got to be really careful, West Virginia. God bless you. And I love you with all my soul. And we're going to get there, but we got to be careful. Thank you.